morning, everyone. Mine will be a brief discussion on the impact of COVID-19 on eye donations and corneal transplantation. There was an overall decrease in the eye donation in the COVID period, which was a 63% decline, and the total corneal transplantation reduced to a 52% drop in the COVID period. So we conducted a retrospective study on the donor and recipient records stored in the Rotary Eye Bank of Arvind Eye Hospital from the period of January 2020 to May 2021. The data was analyzed separately for donors and recipients. Whole globe donor retrievals were done from the Hospital Corneal Retrieval Program through a grief counselor, and the Eye Bank Association of India protocol was strictly followed. Mostly medical legal causes of death like road traffic accidents, suicide, poisoning were considered. Pre-operatively, all the donors were tested for COVID-19, and it was mandatory for the test to be negative. For recipients, careful selection of the pre-operative indications was done, and priority was given for therapeutic and tectonic grafts. All the patients underwent a routine pre-operative testing, and RT-PCR for COVID-19 was done. Post-op visual acuity at 1-3-6 months was done, along with analysis for any graft rejection failure was also noted. The analysis revealed a total of 466 eyeballs from a total of 249 donors in the study period, and the average donor age was 62.43 years. Bilateral donor tissues was received from 217 patients, and unilateral was for 32 donors. During the whole timeline, there was complete stoppage of donor activity from April to June, and there was a gradual increasing trend noted from August onwards. This was also observed in similar trends by Das and Almutak et al. There was a study by Balu et al. Which showed a reduction in number of eligible donors also by 45% during the same period. The most common cause of death in our population, like during the study period, was cardiac arrest, followed by road traffic accident, hanging, poisoning, and then cerebrovascular accident. The most common preservative method was cortisol in 51%, followed by Macquarie-Kaufman. Glycerol preservation accounted for only 1.5%. The Chaurasia and Lin et al. Have effectively proved the superiority of glycerol-preserved tissues in emergency times due to unavailability of fresh donor tissue. The surgical utility rate in our study was 36.4%. The rest of the eyeballs were used for research activities and eyeball training. The main challenge in procuring donor tissue was eliminating COVID-19 as a cause of death. So all the recipients were COVID-19 pre-operatively, and none of them developed COVID-19 actively in the immediate post-operative period. So based on similar studies, as there was no SARS virus detected in the conjunctiva fluid, anterior chamber fluid, and corneal tissues, the COVID-19 donors, there is a very low risk of transmission due to corneal transplantation. The most common cause for corneal transplantation was therapeutic, and the most common diagnosis was fungal ulcer. Fusarium was the most common species that was isolated in our case. There was a total of 17 graft rejection episodes during this period that we noted. So in the concluding note, eye donation and corneal transplantation can be safely and efficiently carried out even in the midst of an infectious pandemic if proper precautions are taken, and retrospective studies like this help in the long run to improvise on the existing system. Thank you.